Hi, everybody. Hey, Emily. This is
Hello.
this is Tim Bentley from the Communications Department. I'm the Marketing and Advertising Manager. And thanks for joining us today. We are going to try something new. We've been doing StreamYard. We've been doing these online presentations for many times for the past couple of years, and we wanted to introduce something new to our viewers today. Emily Rich, who's an occupational therapist in our outpatient therapies, and her colleagues have been presenting an ongoing series on persistent pain. And today we're talking about sleep and pain. And Emily, I'm going to bring in your presentation now, and
Okay.
then I'm going to let you go ahead and get started. I'll be here. I want to let everybody know that if you have a question, if you're watching us live today, you can type it into the comments, and Emily or I will see them and be able to answer them. And if you're watching this on a recorded version, you can also type in your questions in the comments, and we'll get that question to Emily so she can follow up with you at a later date. Okay? Emily, turning it over to you.
All right. Well, welcome everyone. This is our third class in a series that we're doing on persistent pain. And this is our first one that we're doing virtually. So we've got some people here in person, and we've got some people on the computer. So welcome to all of you. Today we're going to be talking about sleep and persistent pain. Here's sort of an overview of what we'll be talking about today. We're going to talk broadly about pain and sleep, specifically what are the issues that happen with pain and sleep, what's the research, strategies to enhance sleep, which is the most important part, probably why you're here today, some details about sleep positioning and options there, and then we'll have a Q&A and open it up to questions, both for those in person and also those online. So a few definitions to start. How do we define poor sleep? Well, it can be challenges falling asleep, waking up after falling asleep, decreased sleep efficiency, or in other words, needing a lot more sleep than someone else. You're not getting very efficient use of your sleep. And then sleep apnea falls under poor sleep as well. And then what is persistent pain? Well, depending on the definition that you use, it's pain that's ongoing and lasts more than 3 months or more than 6 months, versus acute pain, which is more short-term pain that lasts less than 3 months. So we have sort of this cycle that happens in a lot of people with persistent pain, which is maybe you have pain that might cause some challenges with sleep, but then those challenges with sleep turn into a feedback cycle where now we're having more pain. So why are we talking about sleep in a pain series today? Well, I just kind of hinted at it, but the idea that sleep deprivation impairs our pain perception. So as we talked about in the first week when Jake, a physical therapist here, spoke about pain neuroscience, we learned that there's a lot of pieces in our brain about how we interpret pain signals, and we all interpret signals differently. This by no means that pain is psychological or just in your head, but it's that neurological signal being given to the brain. And what we also know is that one night of poor sleep can cause an increased sensitivity to pain, which we call hyperalgesia. We know that getting good sleep can also decrease pain levels. And when people self-report having good restorative sleep, that's associated with resolution of chronic widespread pain. Insomnia, or a lack of sleep, not being able to sleep, predicts developing a painful condition, which this study found in 2013. And women with sleep complaints had an increased chance of developing chronic pain 3 years later. So this is lots of research, and there's lots more. Seems like every day coming out about this relationship between sleep and pain. And then what we know about how pain affects our sleep is that it changes our sleep patterns, whether that's we have more difficulty falling asleep, we don't stay into a deep sleep throughout the night, we have sort of superficial or light sleep patterns, or we actually wake up during the night or early in the morning. And it results in that non-restorative sleep, that fragmented or superficial sleep, and people wake up and they don't feel like they've rested. So what actually is happening when we get poor sleep? Well, we have less serotonin release, And the more we have poor sleep, even less and less that serotonin is released. So it's sort of this positive feedback in that the worse it gets, the worse serotonin release, and then it kind of just cycles from there. And we also see that increased in pain stimulation. Oftentimes people begin to have anxiety or feelings of worry about future nights of sleep. They might feel like, they get their head on the pillow and they say, what if I can't fall asleep? They start counting down the hours. If I fall asleep now, I'll get 6 hours. 2 hours pass. If I fall asleep now, I'll get 4 hours. And that worry just makes that experience of trying to fall asleep even worse. We then see this disruption to the nervous system, their autonomic nervous system, or vice versa, that autonomic nervous system can play a huge role in our sleep. We'll talk about that in just a minute. And overall, we see this downward spiral that often people experience. This is your autonomic nervous system, which Jake talked about in that first week, but just as a review, you've got that left side, which is more of that fight or flight response, and that right side, which is more of that rest and digest or feed and breed response. We need both of these. Both are very, very important. The challenge is when we spend more time in that fight or flight state, where we kind of have that chronic level of stress. And we can see how this really influences sleep, because you'll see toward the bottom there, this secreting of epinephrine, norepinephrine. That's basically adrenaline. If we're producing more adrenaline throughout the day, it's going to make it harder to have a restful sleep at night. And these are just some other signs of how you know if your system might be more in that fight or flight state. So your pupils might be larger. You might have dry eyes. You might have difficulty with salivation. Your heart rate typically increase. More rapid and chest breathing, like that shallow breathing. You have difficulty with digesting your food. And then your hands and feet might feel cold because you're not circulating your blood as well. All right, so what about obstructive sleep apnea, or OSA? Well, what we see is that pain is often present in people with obstructive sleep apnea and vice versa, right? So poor sleep and decreased oxygen or changes in the way that we breathe can lead to increases in pain. And chronic pain often leads to impaired sleep and what we call like sleep disordered breathing. With pain, we also see there's more morning headaches in people that have obstructive sleep apnea than those who don't have it. And we also, excitingly, see that people improve, their pain levels improve with the use of a CPAP machine. The other really important point about obstructive sleep apnea is it is not just a condition of obesity. I think a lot of us associate, well, if you're thin or if you're not overweight, you can't have sleep apnea, and that is simply not the case. So here is a quick screener to see if you might have obstructive sleep apnea. This is not diagnostic. We would definitely want you to go see a medical professional. But a few questions are, do you snore at night? Do you have more tiredness in the morning when you wake up and throughout the day? Has anyone ever observed that you've stopped breathing or feeling like you're suffocating? And then blood pressure. Do you have differences in your blood pressure? And then the stop bang part is, you're more at risk if you have a higher BMI, if you have an older age, larger neck circumference, and people who are male. And so you can see here how to kind of just screen yourself, and it might be worth talking with a professional. And if you do feel like this might be something you're facing, if you're here in Tucson, we have a sleep center, which you can find the phone number here and the address. We actually see children, we're the only place that sees children 1 month of age and older, all the way through adults, and we can do in-lab and home sleep studies. So that is a great option, especially if you're having pain and if you're feeling these symptoms. All right, so what else can help besides seeing a professional? Well, there's 10 things that we're going to focus on today that are areas of sleep hygiene. And this is something that occupational therapists, so I'm Emily, an occupational therapist, that we often do to help people in terms of improving their sleep. All right, so we'll go through each of these one by one. So the first is getting natural sunlight first thing in the morning. So a huge aspect to our sleep is circadian rhythms. These are our natural sleep-wake cycles. They're biological and we don't really notice them. They happen without us thinking about it. We want to activate that early morning piece of our circadian rhythm by bringing in that natural sunlight. That'll help us to kickstart our day. And then throughout the day, by the time evening comes and the sun sets, that's when our body produces melatonin, which cues us to fall asleep. And so if we can really reinforce this idea of the sun rises in the morning and I'm going to soak myself in the sunlight, and that's going to help me to know when the sun sets. So we look at least 20 minutes of natural sunlight, ideally right there in natural lighting. You can be indoors, when you're eating breakfast, especially this time of year, we don't want to be outside probably, or outdoors. So especially at cooler times of the year here in Arizona. And then if natural light is not an option, which fortunately for us, it's very sunny here, but if you live somewhere else or if you travel, for a week's time, even just a couple days can really disrupt your sleep cycle. So what can you do then if it's cloudy or if the sun doesn't rise like in Alaska as early? You might be able to use something like a light box. And basically this is a really bright light and you want to sit about a foot away from it. There's different brands, different types, and most of them aren't more than a foot that they project to. And you want to get one that's at least 10,000 lux. That will be on there. You can find these online. And you just want to make sure you're sitting right within that direct line of the light box. Another option, if you feel like that's not going to happen for you, is these earbuds, which are relatively new. And what happens is you put them in your ears, just like normal earbuds. Some of them even play music and are Bluetooth. But they have a light inside of them, and you press a button to turn it on, and that light projects into your brain and your pineal gland. And this helps just like natural sunlight can help. So this is also a good option for people who here at the hospital might work night shifts or for other reasons don't have those typical sleep-wake cycles. And one brand is Human Charger, but I'm sure there's others out there as well. All right, next we want to make sure that we minimize our screen time in the evenings and avoid it completely right before bed. So what we know is that blue light, after we just talked a lot about sunlight, blue light simulates that in our bodies. And it basically is telling the brain in the evening, the sun just rose, when really we know the sun set. And so it stops your body's production of melatonin, which cues you to fall asleep. And so instead, what can we do in the evenings to minimize our screen time? That could be TV screens, computer screens, and phones. And by the way, putting a cover or changing there's the settings that you can change. Those aren't actually good enough, especially if you're already having sleep issues. So we really want to avoid the screens completely. And so I always say, where can you start? I'm going to ask you to avoid it for at least an hour, ideally 2 before bed. But I know that's not realistic for a lot of people. And so can you start with 10 minutes or 15 minutes? Just see if that makes any difference at all. If it doesn't, I would encourage you to still increase it to 30, try and get up to that hour eventually. Some other ideas are to listen to the audio of a show. You can still listen, especially to your favorite shows that you've seen 100 times. Put your phone screen down so that you're not having that light. Or you can, of course, do things like reading, talking with your family or friends, trying not to stare into that phone, but just having the conversation. And then relaxation, of course. Another important part about lights is that we want to cover all of the lights in your bedroom during the night. So even the littlest bit of light can make a huge difference in your sleep is what we are finding in the latest studies. And so I'm an occupational therapist, so I do not want people to fall at night. I want to make sure you have lighting your path to the bathroom. And so using something like emotion activated light, which you can get at Target or, on Amazon, putting it into in an outlet or something that when you sit up or you stand up, then that light will turn on, but it's not constantly on the rest of the night. Also, there's always the clapper, clap on, clap off, or more modern would be an Alexa, something like that you could use to turn lights on and off. All right, very importantly, we want to reserve the bed only for sleep and intimacy. So our brains have a memory for space. And if we are working, if we are doing different things in our beds, this is especially true for college students, for example, who might only have one studio. Our brain turns into work mode when we're in there. Even people who work from home, and I work with people with chronic illness. I understand you might need to relax, you might need to lay back, put your feet up, but can you do that on the couch? Can you do that in another room, anywhere but your bed? Ideally, avoiding your entire bedroom, but especially that bed is very important. And then at night, creating that space that is dedicated to sleep. And so if you do live in a studio or you don't have opportunities to go elsewhere, maybe you're quarantining, what you want to do is try and change that space in some way from daytime to nighttime. So you might put a cover over your work so that if your desk is in your room, the work is out of sight, right? Out of sight, out of mind. Something that you can do to change that space. And then we want to make sure that it's cool enough at night. So a cool temperature, a drop in body temperature, cues our brains that it's time to fall asleep. And so making sure that you've got the temperature down low enough. Broadly, how do we engage during the day? Well, obviously, everyone knows that we should do some sort of physical activity every day, right? So whether that's walking your dog or simply being upright, and engaging socially maybe with other people. All of these things are going to produce endorphins, release those good chemicals in the brain. And that turns the brain on during the day. It uses some of that stored up energy that we've built overnight, right? And then that way, by the time evening comes, we're tired and we have a purpose in resting. Our body needs that rest and seeks that rest. We also want to decrease our arousal in the evening. So we all know that we shouldn't work or study or do any of those really brain stimulating sort of a thing at night. And the reason why is that nervous system response. So we want to activate that rest and digest state, which it's in the name, right? Rest and digest. So that's the state we need to be in to be able to sleep. If we're in that more aroused or adrenaline producing, that kind of a state is not going to be as productive for sleep. We're not going to get as efficient of sleep. So you might brainstorm today, I would encourage you, a list of 5 things that you could do in the evening. Sometimes I encourage people to make a basket or to have a corner of their room. This can be used in the middle of the night too, to say, what are non-technology things that I could do in the evening to help me go in that restful state? So you might have a basket with some knitting or sewing. There could be word searches, puzzles, anything that is non-technology that you could use to help yourself relax. I also really encourage people to take evening walks. We are so spoiled here in Arizona with these beautiful sunsets. I did not take that photo stock on PowerPoint, but I just, we're so lucky to be here. And there's so much around the idea of watching the sunset, of that reinforcing in your brain, this is time to rest. The world is sort of shutting down for this time of day. And then the beauty of it, right? Like there's a lot of, just good things that our body releases at that time. And then the walk helps you to have that, just not pushing yourself so much that you're getting your heart rate really up, but just a relaxed walk to be ready to rest in the evening. Another part of our circadian rhythm is our meal times. So a lot of people have not heard this before, but breakfast, lunch, dinner, however you do meal times, those also factor in. So I know that 2 weeks ago we heard from the dietitian who encouraged, what's the word for, what is it?
Intermittent fasting.
Intermittent fasting, yes, which is very popular, and she said that it's often really great and really helpful for people. So what does that look like? Well, in my mind, it's just maintaining the consistency of it, right? That some days you don't eat this huge meal in the morning, and then the next day you don't eat anything in the morning, but just finding consistency for yourself, because our bodies thrive on consistency. Our body likes to go into that autopilot mode. So if you're not doing intermittent fasting, we do encourage eating something within an hour of waking up, and then limiting foods 4 hours before falling asleep. It's less work. Your body does have to work to digest that food. And so if you've digested it, you've been upright, that's all finished, then now your body is able to really rest. And then smaller, more frequent meals are often easier on digestion and can help to decrease that fight or flight sort of response. If we've, in this restful state, been able to digest, smaller meals are more manageable for our body. Trying relaxation throughout the day and in the evening. So what works best for you? This is so individualized. But I'm going to give you a few ideas since we can't have the same back and forth conversation that we might have one-on-one. But breathing is always my first go-to. It's easy. It's with you everywhere you go. And we can all benefit from changing the way that we breathe. So I recommend breathing in and out through your nose, building up to longer, slower breaths, but not pushing your body so hard that it's not able to maintain that. And so finding, what is this balance? What's the right amount of length of my inhale and exhale that my body can tolerate? And then building up to practicing this before bed. It's a great way to help you fall asleep. But if you're learning a new skill, that's often not the best time to do it right before sleep. And so I encourage people to practice this, get better at it during the day, and then eventually try implementing it in the evenings. Other ideas are a warm bath or shower. This is sort of a nice trick because it relaxes the body. And if it's warm, your body naturally has to cool down when you get out of the bath or the shower. Like I mentioned before, cooling body temperature is a signal for the body to go to sleep. And so that's a great trick. Using music, conversations, crafts, puzzles, pets. We know that pets lower heart rate. Well, depending on your pet, maybe, I don't know, some might increase it. My puppy might, but in general, right, we know that that's a really positive thing for people. And then limiting any anticipatory or thinking ahead that you're going to not be able to sleep. And so whatever you can do to keep your mind busy enough, going into that relaxed state and trying to just change the trajectory that your typical night might be. Avoiding or significantly limiting naps. So what we know is that napping decreases your body's sleep drive, right? Or we call it sleep pressure. And so ideally, keeping a nap under 15 minutes if you have to nap. We know that the sleep cycles, the way that it goes, is if you sleep more, like 30 minutes and upward until 90, you're getting into these deeper sleep states. Then you wake up, you feel groggy. It wasn't really a productive nap. So what we find is 10 to 15 minutes is actually the best. Otherwise, committing to that 90-minute full sleep. But if you're having trouble sleeping at night, I would really discourage you from sleeping that much during the day. Definitely not after 4 p.m. But usually it's better to try and push through, change your day. If you're really exhausted, it's possible that you're doing too much. That depends on the person, but just seeing if there's other ways that you can modify your day so that you can go to bed at the same time every night. Monitoring your caffeine and alcohol intake. We know that everybody has a different sensitivity to caffeine and alcohol. This is very individualized. But at the end of the day, caffeine is a stimulant. And so even if you're having, a couple of cups in the morning, those will carry through. And so we especially want to limit it after noon. But even decaffeinated coffee is not uncaffeinated. It has caffeine in it. And so even if you have a cup of coffee at 7 p.m. every night that's decaf, that could very likely be affecting your sleep. Again, reducing your sleep drive. And then alcohol, a lot of people say, well, I just have a glass of wine, it helps to put me to sleep. Well, if it puts you to sleep and you stay asleep and you're not having any sleep issues, you're probably not here watching this lecture, right? But in general, it's actually going to disrupt your sleep in the middle of the night. So it might make you sleepy initially, but oftentimes we see those disruptions throughout the night, especially with more than one glass of wine or drink. And then we want to maintain a consistent schedule. So a lot of times this is where people start, right? You need to go to bed at 10 o'clock every night and wake up at 7 or whatever it is. Well, the challenge is people say, I can't fall asleep at 10, I can't wake up at 7. So I like to say, try these other things and keep this consistent schedule in mind. I definitely don't want you going to bed at 2 a.m. if you could have fallen asleep earlier, but it's usually not productive to go to bed at 10 if you're not tired. We then find people have more anxiety about falling asleep, and it sort of cycles from there. So doing all of these other things, and then at the end of the day, really striving toward consistency. I often compare it to a baby that's on a sleep schedule. We those babies grow into us, right? We're adults and that love that consistency and letting the body anticipate what comes next. Then it doesn't have to become so much of a thought that now I need to prepare for bed. It's just the next thing that happens in our evening routine. As I sort of mentioned, it's better to push back your sleep time if you're not tired, but then still wake up at whatever time you want to in the morning. Trying to avoid that, making yourself go to sleep, even if you're not tired, but make yourself wake up. And then that next night, hopefully you're going to be more tired. If you need to change your schedule, like any student this summer who then is going to return to school, we want to do that in small increments. It's really hard for the body to change schedule by 2 or 3 hours overnight. So I usually recommend 30 minutes at a time. If you start at falling asleep at 1 a.m., great. Then a week or two later, let's try falling asleep at 12:30, midnight, backing it up from there. All right, we'll do a few slides on sleep positioning, especially when we have pain. We know that our pain can worsen depending on our sleep at night. And so we recommend sleeping on your back or sleeping on your side. Stomach sleeping is not typically recommended, but I will show you a few examples if that you have to sleep in that way. So you'll see on this picture here, we want to maintain the natural curves of our body, right? Those were not intended to be these straight boards laying on a flat, hard surface. And so if you look at those curves, if you're sleeping on your back, they've got examples of where the pillows could be. We'll go into each of these in the following slides. But we do want to avoid that fetal position of reinforcing more curves, especially on our neck and upper back can be really, really hard. And then we want to make sure our airway is open so that we can get optimal breath. Even if we don't have sleep apnea, our breath is a huge part of how our body functions during the day and also at night. And then letting your muscles relax. So finding any points of tension, or if you're noticing that when I lay in this position, my muscles sort of tense up, well, what can we do with pillows or otherwise? So let's look at some specifics. Pillows are your friend. In any therapy clinic, you will always see a million pillows. There's a reason for that. Support is good for your body. And so you'll see on this top right picture, the first pillow is too high, right? Her spine goes from her back and then into her cervical or her neck, it starts to go upwards. Versus the one to the right, her pillow is too low. And so we want to find that neutral spine. This often means having someone else look at your neck for you, or finding a mirror, seeing if you can do it yourself, maybe set up your camera, but seeing if your pillow is right for you. A wedge in that bottom right corner, you'll see there's lots of wedges available out there, and they can typically be adjusted in many different ways. And so those are often helpful. And then many people with pain like these pregnancy or U-shaped pillows. They can kind of feel like you're floating on a cloud. You feel really supported. So those can be helpful. And then back sleepers. So in terms of those pillows, if you sleep on your back, you might want a lower pillow versus a side sleeper who might want a thicker pillow. And then you might also put a pillow under your knees if you do lay on your back. So let's look at each of these. So sleeping on your back, this is the ideal, is that pillow that has that, almost straight, not too far up, not too far down. You can see the angle of the person's head or their chin, which indicates the neck. On the left, you'll see that if you put a little wedge or towel or something, a pillow under the knees, that helps to relieve any pain in the low back. Again, we're not intended to be in this flat surface if we want to maintain those curves. And same thing in that bottom right, you'll see the option of a smaller pillow or a towel under the knees, bolster. Otherwise, just a pillow can work as well. But if you sleep on your side, well, you're going to want some more pillows. And so lots and lots of pillows are helpful for sleeping on your side. You'll see the picture on the top right. I think they do a great job of showing ways that you can support your body. Typically, we want to bend that top leg, and there's another option for a straight leg. But either way, you want to put a pillow between your two legs. If you think about gravity keeping those, weighing that leg down, compared to how we live in normal life, we've got a gap between our legs or our knees. And so we want to make sure we keep that, relatively our hips are in line, our knees are in line with our hips. And then putting a thin pillow under the bottom hip can prevent that hip from feeling like it's sinking down. And again, avoid curling into that fetal position. So you can see that her head in that top picture is nicely positioned so that her airway is still open. If we come forward, we're closing off that airway, we're not going to get as good of oxygen and carbon dioxide exchange, and that is not going to be ideal. So those are a few ideas for side sleepers. And then if you have to sleep on your stomach, and I can't convince you otherwise, one idea is to put some pillows underneath your pelvis, your lower abdomen, and then also propping your chest up. So basically what you're doing is maintaining the spine curve, and you're giving a place for your head to go. Because what we want to avoid is that classic turning your head to one side or the other when you lay on your stomach. We can all, I think, appreciate what happens when you turn our head for that long. It's just a lot of, unnecessary strain. And so whether we can prop our chest up or putting a pillow on your forehead, then sometimes, especially a firm pillow, will open up space that you can breathe and keep your head in that forward direction. There's so many different mattresses out there now. It's very overwhelming, but the three basic is the inner spring, which is a traditional spring mattress, a memory foam, which is all foam, and then a hybrid, which is a combination of foam and a spring mattress. Usually the best for side sleepers tend to like medium to soft mattresses, and back and stomach sleepers like to have firmer ones, but this is so individualized. And so if you are looking for a new mattress, I would highly recommend going and spending time laying on them. But I think it's important to know that the lifespan of a mattress is really only 7 to 10 years, maybe even less for an inner spring mattress. I know lots of us have had mattresses for, probably decades, with an S on the end of there, not just one decade. And so really worth considering if you have the opportunity to invest, or someone else could support you in investing in a new mattress. A lot of times that can make a big difference. Other considerations are your weight. And then if you're rotating the mattress or flipping it regularly, you might have a mattress that if you sleep alone, you might have a whole side of your mattress that you haven't, really optimized. So you can play with opportunities there. And then also the quality of the mattress and the make really does make a difference in terms of the lifespan typically. Another point here that is just interesting in terms of things you might be able to do is vitamin D supplementation. Now, I am not recommending any type or whether or not you should supplement, but this is something we find in the literature that can be really helpful for people who have sleep issues and chronic pain, this decreased vitamin D level. And so if you've gotten labs drawn or if you have labs drawn in the future, might be something to look a little more into in terms of your sleep quality. At the beginning, I said, that poor sleep can lead to more pain can lead to worse sleep. More of what we're seeing recently is that it's not necessarily true, that bottom part. And so it could be that the pain doesn't necessarily contribute to sleep, but our sleep really does contribute to our pain levels. And so even if you have chronic pain, you have persistent levels of pain, what can we do to influence your sleep? And so hopefully there's been some ideas here today that you feel empowered, that you can take some things into your own hands. A few resources that I like, I just listed one app here, but I know there's more all the time. There's tons of breathing apps that I will talk about in a few weeks. But this cognitive behavioral therapy for insomnia is a really helpful app. It's a funded app, so it's not something you're going to get a ton of ads or anything, and it's free. And it has all kinds of resources like progressive muscle relaxation and breathing exercises, a worry journal, different ideas of things that you can use, and they're all free to you. So I would highly recommend downloading that app and just taking a peek at it. And then you can also get help, of course, from professionals. We have occupational and physical therapists here. We also have speech therapy. And then we have nutrition, which we had someone speak on 2 weeks ago. And so those are all great opportunities if you need some individualized help. And then there are programs for cognitive behavioral therapy for insomnia, or CBTI. You can look these up for people closer to you and find out, there are professionals that are trained in it. There's online modules and programs that you can take. All might be, really, really helpful. And then, as I mentioned, we have a sleep center here. Sometimes there is more of a medical basis for challenges with sleep. And so it's really important to rule those out, and especially if you're really struggling with your sleep. All right, so I'm happy to take questions, both from those here live and also all of you online.
Hi, Emily. This is Tim Bentley again.
Hi,
I think
Tim.
you've done a good job answering questions online.
Good.
I think you did well. You did do well. I will remind everybody that if you're watching this on tape delay, we are here today on Wednesday, July 13th. If you're watching after that date, you can still enter a comment, still enter a question into the comments, and we'll get it to Emily so that she can answer it. Emily, when is what's the next study or what's the next presentation for you all?
Yes, it is the 27th, so that is in 2 weeks.
And what is it on?
And that will be on medication management in chronic pain or persistent pain. And that will be by one of our pharmacists here at TMC, who is not, she's a pharmacist, she's very intelligent, but she actually specializes in chronic pain. So she has a specialized knowledge in this from a pharmacy perspective.
And we will be live online and in person. People can go to tmcaz.com and find this series under our classes and events. And they're able to register for either one. But in your place, which is just across the street from TMC on the south side of Grant, perhaps if they do come, they can stay afterwards and then ask you some specific questions if they have them. Is that correct?
Absolutely. Yes. Yeah. Are there any questions here from anybody? Great. All right. Well, I'll be here for the people that are here in person. And then, like Tim mentioned, we would love to see you at the future events. We've got several great topics still to come, and we will be repeating this series. So if you missed the first couple, you're still welcome to sign up for those future ones. We'd love to have you in person or virtually.
And Emily, this will be online probably tomorrow.
Great.
We did record this today. So also that this will be online and part of the series, but this is the first one. So Emily, we'll see you, or I guess next week or 2 weeks from today, July
Yes.
27th, for the medication management. All right.
Got it. Thanks so much for
Okay.
joining us.
Bye, everybody.
Bye.